Hello, everyone. Someone has asked me if I'm a candidate for a liver transplant. That is a very good question because a transplant is really the only guaranteed proven way to fully recover and be better from liver disease. Even if I remain stable for a long time, I'll still probably have a downturn at some point, and which I'll probably require a liver transplant. So the best approach is to plan for that and try to receive a transplant. Am I eligible? That depends. You have to prove it first. You have to go through an assessment. You have to have blood tests. There are certain requirements that they want you to do, like have certain vaccinations, certain internal exams, for example, colonoscopy, an endoscopy. As a woman, you have to have your yearly exams. They have to check to make sure there's no dental concerns. Oh, and if the patient has ever had any excessive drinking than the, air quotes, average, then typically they'll ask for the patient to please complete a relapse prevention program. And the patient is required to check off all those requirements, and once they've done that, the clinic will discuss and either approve or deny the patient. But if everything goes well with those requirements, then you should be fine, and typically you're approved and added to the wait list for the transplant. I am still in the process of achieving each of those individual requirements that they asked of me to accomplish. And most of them are done. There's a few more tests that I need to wrap up, a few other vaccinations, but that's it. So at some point around December, I should find out whether or not I've been approved or not. So we'll see. And I'm lucky because right now I'm relatively stable, especially compared to before, which was a roller coaster of really awful, bad symptoms from before I was diagnosed all the way until the middle of this year in June. I was in the hospital again. And it was really fairly constant that I was in and out of the hospital until this last June or July. And since then, the amount of times that I've gone to the hospital has significantly reduced. The frequency is down a great amount. So I'm very lucky, but that does not by any means mean that I'm healthy or that I've massively recovered, that I'm cured, or anything like that. It just means that I'm managing all right. I'm doing okay. And that means that I'm taking my medication properly and eating the best of my ability to suit their preferences and requirements. And their preferred requirements for my diet are high protein and low sodium. And of course, a few other important considerations to pay attention to, not having excessive sugar or too much fat, grease, oil, and all that. We want to avoid those things. But that means that my options are limited. And with my ongoing dental work and ongoing extractions, I am less and less able to properly chew. And next week, Monday, I'm having even more teeth pulled. So it's going to be even worse in regards to my ability to chew. I am in the process of getting interim dentures. So we'll see if that helps me, if it works out. Hopefully it will. It'll be good. But right now they told me that the insurance won't cover interim dentures. And that is a huge concern. and part of the reason why I have an ongoing need for donations from my GoFundMe. So if you can donate, I really appreciate it. Truly, I appreciate it beyond words. And if you can't, that's fine. Don't worry about it. I know right now everyone is stressed. Everyone is struggling financially. Specifically, money is tight. So don't even worry. It's definitely not a requirement at all. But it's just appreciated if you can. And if you can't, just sharing my GoFundMe. That will help a lot too. Or if you would feel more comfortable with a tangible donation than a monetary one, just let me know. Contact me directly. And there are several different ways. If you just ask me, I'll let you know. And most important is really that your love and support is the best. I mean, it means the most that you care, that you're thinking about me, that you're praying for me, if that is your preference. I really appreciate it. Even the tiniest phrases and kind words, they really have a huge impact. So I just want to say thank you very much, and I hope you all have a wonderful weekend. Okay? Love you. Bye.